You know, we're really on the cusp of a revolution in medicine. And this one isn't being driven by a new drug, but by code. We're talking about artificial intelligence, and it's absolutely poised to transform healthcare, promising everything from better diagnoses to personalized treatments, and making patient care way more effective than we've ever seen. So just imagine AI as this superpowered assistant for your doctor. It can sift through absolute mountains of data, spotting these tiny, subtle patterns that a human eye might just miss. And that means it can help improve the speed and accuracy of your care. I mean, in a field where seconds and details can literally save lives, this is a monumental leap forward.
Okay, but what if that amazing, powerful tool could be tricked? What happens when the very data it relies on is deliberately messed with, manipulated to make it see something that isn't there? Or maybe even worse, to miss something that is?
And look, this isn't just some hypothetical, far-off problem. To see just how real this risk is, some researchers at the University of Pittsburgh Medical Center decided to put a cutting-edge, cancer-detecting AI to the test. So here's what they did. They took a really sophisticated AI model, one that was trained specifically to spot breast cancer on mammograms. Then they hit it with something called adversarial attacks. Basically, they deliberately messed with the images in subtle, malicious ways, all designed to fool the machine. The results? Well, they were staggering. These attacks successfully tricked the AI 69% of the time. Think about that. They flipped what should have been a correct diagnosis into a completely wrong one. That's more than 2/3 of the time that the AI was totally led astray. And here's the part that's really concerning. It wasn't just the machine that got fooled. The study found that even experienced human radiologists were tricked by these fake images up to 71% of the time. This just goes to show you, these aren't simple little forgeries. We're talking about incredibly sophisticated deceptions. The conclusion here is, well, it's chillingly straightforward. A malicious attack like this could lead to a patient being told they have cancer when they don't, or even worse, being told they're perfectly healthy when they're not. The stakes really could not be higher. But look, these kinds of direct attacks are really just one piece of a much bigger puzzle. The risks that AI faces in healthcare are way broader, creating this really complex web of challenges that we have to navigate very, very carefully. I mean, you've got everything from algorithmic bias, right? Where an AI trained on data from one group of people just doesn't work for another. Or maybe you're using just plain bad source data that teaches the AI all the wrong lessons. Then you have a huge lack of transparency, the whole accountability question of who's responsible when it goes wrong, and a whole bunch of other unintended consequences. It's a lot. And that really brings us to a core problem, something people call the black box issue. A lot of these advanced AI models are so incredibly complex that even the folks who built them can't tell you the exact logic behind a specific decision. And you have to ask, if you can't explain why an AI made a certain diagnosis, how can you ever fully trust it? Or how do you fix it when it's wrong? Okay, so with all these risks on the table, how in the world do we move forward? Well, the answer lies in building some really robust digital guardrails. So let's dive into how national frameworks are trying to create a clear strategy for using AI safely and responsibly. You know, Matt Christensen from Intermountain Health put it perfectly. He said healthcare is the most complex industry. You can't just take some off-the-shelf tool and apply it here. The tools and the rules that govern them have to be built specifically for the unique, high-stakes world of medicine. It just makes sense. And to tackle this, there are two key frameworks from the National Institute of Standards and Technology. You'll hear it called NIST, and they're designed to work together. First up, you've got the Cybersecurity Framework, or CSF. Think of this as the solid foundation for all your IT security. Then, layered right on top, is the AI Risk Management Framework, the AI RMF, and that's the specialized part that deals with all the unique risks that AI itself brings to the table. So the CSF gives you this really logical cycle for just good security hygiene. It all starts with identifying what you have, your systems, and where AI is touching sensitive data. Next, you protect those systems. Then you have to constantly detect any weird or suspicious behavior. And when something does go wrong, you need a plan to respond. And finally, you have to recover and, hopefully, learn from what happened. Now, the AI RMF comes in and adds that specific AI layer. This one starts at the very top with governance, setting up oversight committees and deciding what's an acceptable risk. Then you map out all your AI systems to figure out where things could go wrong. After that, you have to measure how they're doing. Are they performing well? Are they being fair? And finally, you actively manage those risks with real controls, like making sure a human is always in the loop for the big decisions. So you can start to see how these two frameworks really fit together, right? The CSF is that broad cybersecurity foundation. It plays nicely with existing rules like HIPAA, but it's just not specific enough for AI. That's where the AI RMF comes in with its targeted strength. But, and this is key, it doesn't replace that baseline security. You absolutely need both. They're designed to be used in tandem. Okay, so we have these powerful federal frameworks, which is great. But how does an actual hospital put this stuff into practice? Let's take a look at the blueprint that's being created to build that trust right there on the ground. And this is where some really key organizations step in, like the Joint Commission and the Coalition for Health AI, which goes by CHI. What they're doing is taking these high-level, sometimes abstract federal frameworks and translating them into clear, actionable steps that hospitals and clinics can actually use. And their work has created this clear checklist of 7 core elements for any healthcare organization that's using AI. It really covers the whole life cycle, everything from setting up policies and protecting data right at the beginning, all the way to ongoing quality monitoring and assessing for bias while it's in use. And crucially, making sure the people using these powerful new tools are properly trained. So, where does this leave us? What's the path forward? Look, the goal here is absolutely not to be afraid of AI or to stifle innovation. Not at all. The real goal is to manage it, to harness all of its incredible potential while at the same time protecting patients from the risks. And the key is that dual approach we've been talking about. You start with that solid cybersecurity foundation from the CSF, and then you combine it with the thoughtful, specific governance for AI that comes from the AI RMF. You could almost say one protects the systems and the other protects the patient from the algorithm itself. And it's so important to remember this isn't happening in a vacuum. It's going to take a massive collaborative effort. These public-private partnerships, like the Health Sector Coordinating Council, are absolutely essential for figuring this stuff out and sharing the best strategies across the entire healthcare industry. At the end of the day, AI isn't just another new tool. It's a fundamental shift in how medicine is going to be practiced. It really does offer a revolution in care. So the critical question we all have to ask isn't if this revolution is coming. It is. The question is, how do we build the systems, the guardrails, and the culture to make sure it's a revolution that every single one of us can actually trust?